Okay, we're going to get started. So, hello everyone, and welcome to today's webinar, an enhanced community risk reduction effort in the second largest township in Ohio, Colerain Township. My name is Melanie Gibney, and on behalf of Hamilton County Public Health's harm reduction team, I'd like to thank you for joining us today. So during this webinar, all participants will be in listen-only mode, and at any time during the presentation, you can enter questions into the chat box. Questions will be answered at the end of the presentation, and if we don't get to them all, we will send out a summary and an FAQ at the end with the recording and the presentation slides. If you experience any technical difficulties, please let me know or Philip Graham know. He's the co-host. So we will begin with today's agenda. So like it says, you'll hear from myself from Hamilton County Public Health, as well as Rachel Akra from Hamilton County Public Health, and also Colerain Township Department of Fire and EMS, and then we will go into our Q&A at the end. So by the end of today's webinar, we hope that participants will be able to describe the need for innovative harm and risk reduction efforts in large townships and communities, and identify key elements on how to replicate this program in other communities and create buy-in from external partners. So I will do a few introductions. So Rachel Akra has lived in Cincinnati for the past 11 years. She attended the University of Cincinnati and received a BA in psychology. She also received certificates in substance abuse counseling, substance abuse prevention, violence prevention, in families, schools, and communities. She recently obtained her CDCA certification, and Rachel lived in South Korea for a few years, interesting fact, after graduating to teach English. She's worked as a mental health case manager, a housing case manager for homeless youth, and an advocate for domestic violence survivors. Rachel has been working at her current job at Hamilton County Public Health since 2021. Will Mueller is an assistant fire chief with the Colerain Township Department of Fire and Emergency Medical Services. He's a 27-year veteran of the fire service and holds certifications as a firefighter, paramedic, fire safety inspector, fire instructor, and EMS instructor. He serves as an adjunct professor for the University of Cincinnati and a research associate for the University of Cincinnati's Healing Communities Study. Chief Mueller is a graduate of the Ohio Fire Executive Program, earning him the Ohio Fire Executive designation. He holds a bachelor's degree in emergency services management and is in the process of obtaining his master's degree in higher education, specializing in adult education, higher education, and higher education administration and leadership. So with that, I will turn it over to Rachel and Will.
Hi, everyone. Thank you so much for joining. Like Melanie said, my name is Rachel Akra. I am a health counselor and the Colerain Township Community Health Coordinator through Hamilton County Public Health. And of course, we have Will Mueller, Assistant Fire Chief. We also partnered with the Colerain Police Department, but unfortunately, they were not able to be on this today. But I will go ahead and get started. Melanie, if you could go to the next slide, please. So just a few discussion points for today. We're going to kind of provide a geographic overview of Colerain Township, just so you can get an idea of the community and population that we're working with. We're going to discuss a little bit of how this role of community health coordinator came about and how we created that. We're going to discuss the importance for addressing psychosocial needs, in addition to addiction and recovery resources. Provide an overview of the community health coordinator job description and explain the role in terms of the referral program that we do with first responders and the quick response team. We'll discuss a little bit of the data and the criteria we use to evaluate the program, and we will evaluate capacity for jurisdictions to replicate the referral program and other services that we do. And at this point, I will throw it over to Will.
Thanks, Rachel. And you can go ahead and move to the next slide there, Melanie, as well. Good afternoon, everyone. So just real quick, I want to discuss some demographic data and just give a little background of what Colerain looks like, both geographically, demographically. So first, you can see the map there of Hamilton County, and Colerain is highlighted in red. A lot of people don't understand the size of Colerain. We are an all hazards community. We encompass a very diverse community as well. We encompass industry, commercial, residential, urban, suburban, rural components, and which makes us very unique in that sense. We cover a large geographical area, roughly 43.2 square miles. It's very specific, which is off the website. And then what really makes us unique as well is that a lot of these spaces or these areas are rural, hard to get to, especially along the western border that encompasses the Great Miami River there. We have about 60,000 residents, actually just slightly less, that live in approximately 23,000 households. That population swells to roughly 110,000 during an average work day. And you can see the median household income there. From a fire department's perspective, we run out of 5 fire stations. We employ 150 fire and EMS personnel. And then real quick, from a law enforcement perspective, we're running out of 6 beats with approximately 64 law enforcement personnel. Melanie, you can go ahead and switch to the next slide there too. And you see Melanie did kind of post a comment there in the chat that if you have any questions, you can go ahead and throw them into the chat there too as we go. And then Melanie will facilitate those at the end. So here's a little demographic overview. So when we talk about the need for this program, that was one of the points of this discussion, right? One of the objectives. The need for this program exists in some of this particular slide right here. So 40% of our population is 65 years of age or older. And no doubt the majority of our run volume comes from that demographic. Not pointing fingers, not saying they're part of the problem. That's just the data. Those are just the numbers. Also, we have to look at what that demographic presents for us. It does represent our number one run maker, which is falls, which represents about 14 to 15% of our run volume, which is 1,200 runs. So we respond to about 1,200 falls each year. The scary part of that is the ones that we don't know about. So, and we'll get to that here in just a little bit when we talk about need. Now, I don't want to sit here and read all of these particular numbers off to you because they're right there in front of you. Point out a couple of things here. That 31% minority population is pretty huge. And about 24 to 26% is African American. But what gets lost in some of that translation is approximately 3,500 people, portion of that 31%, is Nepalese Bhutanese. And so that's a fairly large population. And we're one of the largest areas that have such a large population, or I guess we're one of the areas that have such a large population of that particular demographic. So a lot of our outreach programs are geared toward that population when it comes to translation services and things like that. So you'll see a couple of numbers here that represent our overdose responses. And they're slightly different because they represent different years as we're putting through the program together rather. And so that 153 overdose calls was 2021. In 2022, we actually ended up with 118, which is a 10-year low for us, which shows the efficacy of the programs that we've put into place since 2014, which I'll talk about here in just a minute. And this number here, approximately 1,700 calls, which represents about 20%, contain a scenario where we felt, meaning our first responders, police, fire, EMS, felt that there was a greater need than what we were called there for. So in other words, we're called for difficulty breathing. We're called for somebody who fell. We're called for a domestic violence or an injury related to domestic violence. And when law enforcement and police and fire and EMS are on the scene, through either observation or through assessment, we recognize that there's a greater need here than exists beyond the 911 call. So that 20% what's significant about that is when I did a study in a research paper back in 2015, that number was 32%. So we're actually down now since that time, and I know a large portion of that has to do with the work being done here. So that's fantastic. Melanie, you can go ahead and move to the next slide. So what is a community health coordinator, which is the program we're here to present this afternoon? So back in just a little bit of history, back in 2014, when we started to develop a response to the opiate epidemic that was occurring in our backyard here, we felt that an outreach program that was bringing resources to the doorsteps of those in need was really important. We realized that that was a missing piece. In other words, there were resources, recovery resources available, but there was a missing piece, and that was the connectedness to that, right? That handoff or that connection point. And so we created what was called the Quick Response Team back in 2015, which was the nation's first model of such. And at that time, it was a program geared towards specifically addressing the opiate epidemic. However, we also realized that this model could be used for something a little bit more. In other words, we could take somebody who's a referral hub, if you will, and not only get them connected to addiction resources, recovery resources, but what if we started to address some of our bigger aspects of health that are not health related? In other words, social determinants of health. And so that was kind of the goal. That was even kind of the vision back in 2015. In 2019, we had a very unique opportunity to partner with public health. Colerain Township had a very unique opportunity. We were invited to participate in a collaborative with Hamilton County Public Health that would supply us an individual who could be that resource hub. Again, not just for addiction, even though that was the primary drive for the partnership, but to address all of these other social determinants of health. And when we were creating the program, we sat down and started to think, what are we even going to call this, right? It was somewhat of a pilot program that was grant driven, but it was a unique opportunity. It was an opportunity to create something different, and we had a clean slate. And that was the really exciting thing about all of this. Like, none of this had been done before. We could do whatever we wanted. There were no lines, and I really appreciated that from your agency, Hamilton County Public Health, that ability to be able to create a program with literally no margins, and to say, hey, let's do this thing. Let's make it work. And so we sat around. We said, well, we're dealing with health, we're dealing with the community, and we're dealing with a referral hub. And so that would be coordination efforts. So we came up with this name, the Community Health Coordinator. And so all that being said, this is exactly what we're talking about. We're talking about an individual, in this particular case, Rachel, who's been absolutely amazing to work with. She is this, just picture this image of this spoke. I'm going to show you a picture here in just a little bit. The center circle with all these different spokes coming off of it, with all these different referral types and all these different social determinants of health, some of them being social determinants of health, and being a connection point for the individuals that we run into on 911 calls. So we have this person who's able to connect people to all the resources. The people, the client base for this comes, thank you for the switch. The client base for this comes from the patients that we run into on our 911 calls, right? That's where we have the ability to affect change. That's where we're battling a lot of these things, or seeing people battle them at ground zero. So this is the graphic I was telling you about. So you have the Colerain community with a health coordinator there in the middle, right? And then you've got all these services that are around there. So how this program works, I'm gonna get ready to turn it over to Rachel here in just a little bit, but how this program works is when our law enforcement personnel or our fire and EMS personnel are on a call, a 911 call, they have the ability to look beyond what is right in front of them. They have the ability to look at Mrs. Smith and say, hey, you know what, this is what's going on with Mrs. Smith right now. However, wow, it's hot in here. Mrs. Smith, is your air conditioning working? Oh, honey, it hasn't worked in months. I can't pay for it. I don't have anybody to fix it. That's a social determinant, right? The stress and the inclement weather, that's a social determinant. So our personnel have the ability to say, I'm going to check this box, and they check a box in their EMS reporting system, and that kicks off, generates an automated email to Rachel, who then receives the email and says, oh, this is where I'm going to follow up. Right. So addiction is the same thing. And when I talked about opiate addiction before with the quick response team, but this really opened up things for us. We're able to address all kinds of addiction now. We don't, because addiction is addiction. So recovery resources. So we kind of expanded the scope of what that looked like as well. So children's services, medical services, when we see that Mrs. Smith hasn't been talking to her primary care physician for some time, we have the ability to help drive some of that then. So that's kind of what that's the background information. You have a little bit of history of Colerain, where we've come from, and community risk reduction, as this presentation named, is perfect, because that is exactly what we're in from a fire service perspective. We're in the business of reducing risk. Community risk. We've done it from a fire department perspective for decades. We have developed fire codes to keep people safe in buildings, right? That is community risk reduction. We keep people safe out there through code enforcement, through fire department inspections, assuring that there are working fire detection systems and smoke detector systems in businesses, fire extinguishers. We have an entire code book, literally this thick, dedicated to fire safety. Community risk reduction in this particular case, as it pertains to SDOH or social determinants of health, is exactly what fire code is for EMS and for medical and for social services. We're doing the exact same thing now for social services, and it's a very exciting time. I will kick it back to Rachel now. Thanks.
Thanks, Will. So I thought we would just jump in and kind of talk about the job descriptions. The job description of the community health coordinator, and what we came up with. So a big part of this position that I'm serving as is serving as an expert or advisor for substance use disorder and addiction, which does include the QRT quick response team, which some of you may be familiar with. The model is, we go out once a week, and I'll get into this a little bit later in the presentation, but we go out once a week to follow up with people who have had an overdose. And I kind of serve as this advisor for substance use disorder for referrals that first responders do send to me, but also, just anyone in the community. If I get a referral from a community member, or if there's any employers that are having, they have an employee that's having a substance use issue, then I can, work with them in that capacity as well. Also work with, like we've kind of talked about, the fire, EMS, and police to provide care coordination and link these individuals to resources, kind of serve as this hub. Like Will was saying, we like to call it kind of like a linkage of care. And I'll kind of do a deeper dive into this stuff a bit into the presentation. We will assist with second chance employment programs by working with the businesses in the Chamber of Commerce in Colerain. And then lastly, partner with the school district there in Colerain, which is the Northwest School District, to provide prevention and intervention for students who are using drugs or alcohol on school campus for the first time. You can go ahead to the next slide, Melanie. Okay, so to take a little bit of a deeper dive into our quick response team in Colerain, I do go out with, it's me, a police officer, and a paramedic. We go out every Thursday morning, like I said, to follow up with individuals who have experienced an overdose. And as Will kind of stated, our QRT has expanded a bit. So when it started, it was kind of those unintentional heroin overdoses, but now it includes a much more vast population. So it includes intentional or unintentional overdose incidents. Occasionally, we do get someone who had an intentional overdose, and we do follow up with them. And it includes any kind of substance use, not just opioids, whether that's alcohol, meth, anything. So it kind of opened up that, arena for the quick response team. Like I said, the team consists of me, a paramedic, and a police officer. And we also offer all the individuals any treatment resources. Of course, the goal is to, provide those treatment resources if that's what they want. But really, the goal is to let them know that, I'm here. If at a later date they decide treatment's not what they want or need right then and there, I give them a card. I'm always here. let me know and we can look at treatment options at a later date, but always making sure that they have access to harm reduction supplies such as Narcan, fentanyl, testing strips. If there's any other needs that may come up while talking with them on scene, addressing them as well, whether that's homelessness, whether that's they don't have any food in the house or they don't have the clothing that they need for the weather that's going on, whatever comes up, the quick response team kind of addresses that in real time. We do have, what we call QRT bags as well, includes, basic snacks, water, basic hygiene items, toothbrush, toothpaste, deodorant. We give those out to anyone that we come into contact with on the quick response team that may need it. And kind of what I've been talking about here, it has morphed into a little bit more than just addiction and recovery focused. Any community member that has been identified as needing assistance, we can do a follow-up during the quick response team. It's nice because I get referrals from police and fire, and I have a police and fire person with me. So any referrals that they have sent me, if I feel like it could be beneficial to have those first responders on scene, we can go out during, the quick response team time to follow up with these people. So it's kind of course, addiction and recovery is a main focus, but it's, evolved into something a bit bigger. And then not sure if people on this call are familiar with core data, but we do enter the data for each client into that system. Melanie, go ahead and go to the next slide, please. Just some quick data for 2021 for the QRT. We did have 146 overdose responses. We were able to follow up with 101, 69% of the total overdoses. And we do keep it to Colerain. So the individuals have to reside in Colerain Township to be eligible. If we do get someone who overdoses in Colerain but doesn't live there, we'll refer them to an outside quick response team to wherever their residence is. We did have 69 face-to-face connections, so 68%, and then we had 42 people engaged in treatment, so 61%. Melanie, go ahead and go to the next slide, please. Just a quick graph of the overdose responses in Colerain. As Will said, it has been trending downward, and we are at an all-time low there in Colerain Township, which is a great thing to see. Yeah, and Will, if you want to elaborate on that at all, feel free to jump in.
Yeah, so just real quick, so you see that spike there in 2017. When you overlay some of the county data and other state data, you see that everybody had this spike in 2017. That spike represents carfentanil, the introduction to carfentanil on tourist streets, and it was a horrific year in terms of not just overdose responses for Colerain Township, but the associated death toll with those overdoses. So that was a very horrific year that I do not ever want to repeat. However, since then you see that our numbers have come down, and we're seeing our lowest numbers again since for the last 10 years, since 2012, when we began to see our first spike. So yeah, so I just want to explain kind of whoa, like that's a really big jump, but it correlates to a lot of different jurisdictional data. Thanks, Rachel.
And just to clarify, does the chart show the number of EMS responses for overdoses for the whole year or not, and not just fatal ones? Or is that fatal?
Correct, Melanie. These are just total responses. And these are specific to opiate-related overdoses. I want to make sure I point that out too. So yeah, these are specific opiate-related overdoses. The graph says that, but sometimes people look at numbers and they don't exactly know what they mean. But yeah, so we were able to dig down pretty deep into the data and make it very specific to opiate-related overdoses. Good question.
Thanks, Will. You can go ahead. Thank you. So one of the really large pillars of this program is the referral program with the first responders. So what's unique about it is we are partnered with both fire and police. I know there are some other positions out there that's partnered with one or the other, but the great thing about this is the collaboration between both departments and myself. So the EMS, or fire and EMS and PD refer people in two different ways. So fire does have me in their online reporting system, and while on scene, the crews, if they encounter someone who, like Will was saying, think that could use some extra services, They can just check a box and then that gets electronically sent to me through email, and I can go in and view the report. Whereas the PD, I'm not in that system electronically, so they do everything on paper. And I have a mailbox there where they put all their referrals in and I get them. As I go into the station, here you can see the categories that we decided would be cover most of the services that's needed in Colerain. Of course, we have addiction services, mental health, domestic violence, environmental would be things like hoarding, or if people are just living in kind of deplorable conditions and may need some assistance with that, things like that that's going on with their environment. We have the basic needs, food, clothing, financial assistance. We have medical services, which Will slightly touched on, people who don't have a primary care physician that need one, or they're not going regularly, or a lot of times I'll see elderly people who need some assistance in the home in terms of medical needs, that they may need like a caretaker. Then we have senior services, which kind of encompasses the falls like Will was talking about, or just, elderly people who may need like Meals on Wheels, kind of things like that. And then we do have veteran services that people can refer. If needed, I have had the fire and EMS and PD call me if they're on the scene, and they believe that my presence being there could help. I have gone in real time to assist on the scene with whatever's going on. I always make sure that there's open communication with myself and the first responders, to let them know that, the people that they are referring, I am helping. Let them know what I referred them to, what services they're receiving, and let them know what the outcome is of each referral so they can see the difference that it's making. And then again, all data is entered into core data. Melanie, next slide, please. Just some quick data on the referral program. So this is from 2021. We did receive 352, and that's fire and EMS and police combined. 303 of those referrals, so about 86% were eligible. And like I said before, that eligibility is that they live in Colerain Township. Occasionally I do get referrals where the incident happened in Colerain, but they live outside of the jurisdiction. So I don't just kind of leave those people, out to fend for themselves. So I'll refer to outside resources where they can connect them. There is a county QRT here in Hamilton County, so a lot of people do get referred to them that don't live in Colerain. In 2021, the community health coordinator, was able to contact 183 of that 303 clients, so it's about 60%. 118 of those, so about 61%, were referred to services. And you can see on this circular chart, the highest or most common referral type was addiction services, and that was with about 24%. Medical services was next. As we talked about, the elderly population is very large in Colerain Township, and it serves a lot of the calls that first responders get. So medical services did come in second with about 19%, and mental health services was the next most common referral type with about 16%. You can go ahead to the next slide, Melanie. So one of the other large pillars of the community health coordinator is the partnership with the Northwest Local School District. So what that is I work with any student that has a first-time drug or alcohol offense on school grounds. So any student that is caught with any kind of drug or alcohol, or if they're caught, high or drunk on school grounds, they will give their parent my information. Parent reaches out to me, and I do then schedule a time to meet with the student and the parent, and just to kind of go over what's going on. The school does require the student to take a drug test, and then of course meet with me, and that kind of lets them avoid prolonged suspension or possible expulsion. As long as the students do everything that the school requires, then they usually won't get expelled. I do use a very short screening interview with the students. It's called the craft interview. I do have a link there. I believe it will be available when Melanie sends out the slides at a later date. And it's very short, a couple of questions. And asks about I'm trying to think. So it asks about how many times they've used alcohol, how many times they've used marijuana, and then if they've used any other drugs. And then it has some questions at the bottom. And the goal of that is to kind of take a look at their, behaviors and see what's going on with that. And kind of my job is to give referrals to the family. Do we think that they need extra drug or alcohol treatment? Do we think they need mental health treatment? And kind of give them those resources within the community to help that student. And then in 2021-2022 school year, I met with 46 students who were referred to me from the schools at that time. Okay, next slide, please. Will, if you want to take it from here.
Yes, so I just did pop that link into the chat as well. For
Thank
people.
you for that.
Sure. Save an extra step. And I know there's some good questions coming through, which I know Melanie will handle here in a little bit. So moving forward, right? So you can't go back, we can't change things, but wow, we can change things moving forward. And this is, this has been such a valuable experience. When we started this endeavor, we didn't know what we didn't know. And we were just open to making mistakes. We're certainly open to our successes. But as we move forward, we're going to continue to find ways that we can reach out to the community and increase our effectiveness. If we want to look at this program at this programming as a means to get people connected to the right resources that they need in the first place, to increase their quality of life, if we want to decrease healthcare spending, if we want to increase, or I guess increase longevity of CMS services in such a way that we don't have to decrease benefits or increase costs of those programs, then we're going to continue to focus on these types of upstream services and programming. That is really where we need to be. This is the space that we all need to exist in. And public health gets it, right? Public health has been in the upstream business for its existence, since its existence. Prevention and education. And in this particular case, being able to branch out, and I'm so proud of this, of our county, really, and the willingness and desire and the vision that Hamilton County Public Health has to branch out into linkage of care, really for the first time, and COVID's really given us an opportunity to do that. But this program has really afforded us the opportunity to do it as well, to branch out into linkage of care, so that we can get people, again, connected to the right resources. Otherwise, they're going to continue to use the cheapest entry point into the healthcare system, or I should say one of them, not the cheapest, the easiest point of access into the healthcare system, which is 911 utilization. We're not in the business of necessarily trying to reduce our 911 call volume, because that shouldn't be the focus, because that's not patient-centered. We need to focus on programming that's patient-centered. The rest of it's going to take care of itself. But anything that we do, every decision we make is going to be for the interest of our residents and increasing their quality of life. That is all that I have for moving forward.
Yeah, I think we can take some questions. Thanks, Will.
Yeah, that was really well said and a great segue. Thanks, Will and Rachel, so much. That was a great segue into some of the questions that we had. I'm just making it more about patient or client-centered, more about the client rather than just talk about the data too. We tend to focus on the data a little bit more. So I appreciate you saying that. So we do have quite a few questions coming in. So, and we have plenty of time to answer them all, hopefully. So, what, if any, certifications are required or offered as police departments or as PD in the community health role? So, did you basically, what other certifications are needed?
So I'll take that for police and fire, Rachel, and then you can talk about your kind of role in training. From a police and fire perspective, honestly, when we broke out into the addiction piece, we were really focused on trying to get our medics and our police officers engaged in the program. It was volunteer. Not everybody has to do it. But we were really intentful about getting them trained or going through that first week training of the chemical dependency counselor training, CDCA. And the point was not to have them become certified fully as a CDCA, but we wanted to immerse them a little bit more into the world of addiction so that they had the ability to speak addiction, if you know what I mean. So addiction has its own language, and it's a new world to us. And so for those who have been blessed enough not to have to deal with it in their lives, or we wanted them to be able to be a significant portion of the team be able to talk. In other words, we didn't want police and fire just sitting in the background in the corner of the room while peer support or Rachel was doing all the work. We want them to be part of it and to be able to assist in the conversation and function as a team, right? So that we can better form those relationships there on the scene. So that was really a big piece of that. Initially, there was some self-defense training that our medics went with the PD. But we're now almost 10 years into this program, and we have yet to counter a violent victim. As far as the PD is concerned, really, there wasn't any specific training. Colerain Township has had a fairly decent infrastructure in terms of the way they responded to the community in a community policing kind of way. So that was already in existence. So it was a relatively easy transition without having to produce a whole lot of additional training, which made it somewhat of a less expensive implementation then. Rachel.
Yeah, I just to kind of add on to that, I will say there's no certifications that like we offer through public health, but the police department and the fire department do kind of their own training in terms of QRT. They kind of find people within the departments that they think would kind of be champions in the program, and then do a specific training with those people about what to do. And then we do like a shadowing for QRT for a new fire member or a new police officer that would like to start doing QRT. They'll shadow us for a couple weeks and then jump on from there. In terms of like the referral system, I do go in and occasionally do trainings with the departments just about what I do. Of course, there's always new crew members coming on in both departments. So I'll just do short trainings on what I do, what the referral system is, what the categories are, and then offer up any questions that they may answer.
That's great, thanks. And I do think that they chose the right person for the job, Rachel, to be the community health coordinator. So I thought that with your background too, I think the certifications you hold are great. And with that, did you also talk more about the core data system and what that is? And did you do trainings yourself to understand that system?
I do not do trainings on the system. I learned a little bit about the system from one of my coworkers, and then you can reach out to the core data and have them do some trainings with you. It is, primarily focused on overdoses. The system is, so you can the good thing about core data is you can alter it. If you work with the members of their teams, you can alter it and kind of form it into something that will work for your program. They're very open about adding things that works for you or changing things. So it's a great system, especially for overdoses. And like I said, they'll work with you on trying to make it so it fits your role, because this is a very unique and specific role. So the system wasn't really built for what I do in terms of the referral program, but they have worked with me on adding different badges or adding different follow-up forms so that I can track my data in there.
Yeah, so it's just more of like a secure data platform.
Right. Yep.
Yeah. Okay.
And I know at least the other QRT team here in Hamilton County does use it. So it's pretty widespread, at least within the QRT realm.
Great, thanks. And then what is the turnaround time from referral to outreach to connection to services and resources?
So this is a little bit hard to answer just because every referral is so different. Every person that is referred to me is, is such an individual, and they're all requiring different things. I do try to follow up with a referral within 48 hours. The referrals have gone, up and down. It's like an ebb and flow type of thing. So those months where I am receiving a lot of referrals, and it is kind of hard to keep up with that 48 hours, but that's the goal. And then in terms of connecting, it's really, up to that individual. I do try to call first rather than doing just like a home visit. I have done that and it didn't go over very well with some people in the community. So I do try to call first, and I do call 3 times. If I don't get an answer, then I will go out and do a home visit. So it really depends on if I can get a hold of them. In that first time I do get a hold of them, I do, like a very short assessment, but the assessment is more of like a conversation. Tell me what's going on. What do you need? What can I do to improve, your life? And then we kind of go from there. And then on the spot, I will refer to any kind of services that I can. Some places they do have to go in for an assessment, so we can set that up. But I do have some community partners where I can refer on the spot, and they'll reach out to that client to help them. I just have one more thing to add to that. I will say within this position, it is really important to, establish those community partners, because like we said, this position is more of linkage to care. It's not a case manager position where you're providing the services. So, in making sure that you have those community partners so they can provide the services, and connecting with them and making sure those community partners know you and know what you do, and make sure that the connections are strong so you can refer the community members to them and know that they'll get the right services.
And do you think it helps you not being in uniform too, to go knock on doors and also be the referral connection, or does that make a difference?
Honestly, I mean, I do always wear, I'm not in like an EMS or a PD uniform, but I do wear something that shows that I work for the health department, or something that says Colerain Township. I think what helps is having, a lot of times when we follow up with people, the police officer or paramedic that's with me could have been on scene when the incident happened. So having that community members see, oh, this paramedic or this police officer actually cares about me and cares about the outcome and cares what happens to me, I think that's a really strong factor to this program.
Agreed. Yeah. And then in the pie chart, what types of things are included in social needs? I'm trying to find that.
I think you passed it.
Yeah,
Maybe
right
the next
here.
one. Yeah, there it is. So we have kind of lumped together as social needs things like homelessness. I think that should say basic needs instead of social needs. But things like homelessness, clothing, food, financial assistance, whether that's rent, utilities, things like that. So like basic needs that, you need to thrive.
Great. Thank you. And then this is kind of a general question for both you and Rachel. What are some of the challenges you faced as you instituted the community health coordinator program that you would warn people against to plan for when they're starting something like this? And go ahead.
Oh, I was just gonna say, Will, do you want to jump in, or you want me to start?
Oh, sorry. Big fingers, little keyboard. Go ahead and start that one, and I'll wrap it up.
Okay, yeah. So I will say, Colerain is a very innovative community, so it was really good place to start this project, just because they're on the forefront of these kinds of things. I mean, they started QRT in that community. They're very open. They're really passionate about bettering their community. So we had a little bit of an advantage there. For a community that, is not as open or not as innovative, that may show some resistance, I would suggest going into the fire department, going into the police department, and finding that one champion person that you're going to get buy-in from. And because that person's, surrounded by these agencies, they know the people. It's really hard to come in as a stranger and to this culture of first responders and just say, hey, I'm here to help. And a lot of times they're a bit resistant. They're like, I don't understand what you're going to do. Are you going to, make more work for me? That kind of thing. So finding that one champion in those departments, talking with them, explaining what this program is, why it will help, get that buy-in, so then they can go to, the other officers, to the other crew members, and get that buy-in from them, so you're not having to just jump in cold feet. that's probably the biggest thing I would suggest if you're going to start, a program like this. It takes a lot of planning. I will say that I wasn't involved with the initial planning, but I know it took quite a while before I was hired on to figure out what works, what doesn't work, that kind of thing. Yeah, Will, you have any thoughts on
I think finding the right person to do the work. That was, we'd interviewed a few, and it just takes a special person. This person was going to function in a capacity that we had no blueprint for. And it was going to be a very autonomous position. We needed somebody who was going to be really self-driven, motivated, who had organizational skills, who had communication skills, who had the ability, desire, passion to help people at the level that they need. Patience, with this person needed a very a lot of patience. And so finding the right person, that was one of them. And the other thing, and Rachel alluded to it, but it's education when it comes to culture change. We are, from a fire and EMS and law enforcement perspective, to a degree, we are stepping outside of our traditional roles, right? We're changing the landscape of the profession. We're asking people to do things that wasn't necessarily part of their job description when they were hired. And as Rachel mentioned, we, since 2014, we have been stepping outside of our traditional roles and challenging our personnel in different ways. But it took some time. It took some time to really get to where we needed to achieve the necessary buy-in. And I think, one of the proven factors there, the metrics that we use, is just the number of referrals that Rachel received to indicate, yeah, our crews get it. Our crews are willing to really try to find out what's going on with Mrs. Smith here and care enough to take next steps to get them connected to Rachel. So those are the barriers. Again, just to recap, some of that is finding the right person, education, cultural change.
I do just want to add just a couple more things on that. I will say, especially in a community that, has never seen something like this, I think it's really important to, instead of jumping in, feet first, ready to go, I'm ready for these referrals, kind of sit down with the crews and the officers, really get to know them, show them that you're there as a partnership, not to take over, not to tell them what to do, not to make more work, but really just show that you're there to help the community just like they are. Just really get to know them, maybe shadow them. And then I think that helps get you in the door and lets those first responders know, like, oh, okay, they're here not to make things harder, but to make things easier, really.
Yeah, that's great advice. And then in that vein, to get the project up and running, did you need specific data to show funders or potential partners to justify position for the program?
Will, I might send that one over to you just because I wasn't there for those, initial.
Sure. The data that we had wasn't really something that Hamilton County Public Health was aware of at the time we were approached for this collaboration. But the data that we did have was the need, the research that I did back in 2015 that demonstrated that we had 32 to 33% of our calls required, had someone that we encountered someone that required additional assistance above and beyond the 911 call. That was a third of our calls. And when you're making between 8,000 and 10,000 calls, that's significant. That is significant. There was a lot of social gaps that were existing in the healthcare of individuals that we were responding to. So we had that need. That wasn't something that we necessarily had to use to demonstrate why Colerain was a good place to start this pilot. Shauna Merrick was on the call earlier. I don't know if she still is. She's the one that was part of our initial quick response team effort and knew kind of the infrastructure that Colerain had to be able to reach out to the community first and foremost, because that was really a big requirement. Was there a community that had this process in place that was already going, that could be a quick turnkey solution to start, and we could just hit the ground running, basically? So that was probably one of the biggest requirements, if that makes any sense. So the way this whole pilot program came about was a little bit different than us saying, hey, we want to do this. Now we want to go out and find support for it.
Sure.
Yeah, and I'll just add on, now that we do have that data, it is, vital in showing the stakeholders in the community, like, look, we know this program works. Look at this data. So we do have that now in order, to show, let's keep this going. You know what I mean?
Yeah. Thanks. And then, so I'm going to come back to this question related to overall Hamilton County, but we had a question about how does the community respond to this, or is there feedback to this program or any notable interactions of providing resources to people in the community?
Yeah, just from working with the different people in the Colerain community, I will say I do get some people who are resistant just because it is a very unique position. A lot of people don't understand exactly, what I am or what I do. Especially it is a bit confusing that I work for public health, but I'm partnered with fire and police. So a lot of people are like, well, so do you work for fire? Do you work for police? I'm not struggling to understand where you are, but most of the time I will say people are very pleasantly surprised that something like this exists. A lot of times if you have an incident where police or fire and EMS are called to you, you don't get a follow-up asking, how are you? What's going on? Do you need anything? So usually when I reach out to people and say, look, I work with fire and police. I'm just here to, see what's going on. If you need anything, did you get the services you needed with that call when you went to the hospital? A lot of times they're like, oh, this is something you do? I had no idea police and fire did something like this. So it is a really good response usually from the community. And of course I do have quite a few success stories of getting people connected to resources. I won't go into all that, but if you are interested in like specific success stories, I think my contact information is on the slides when Melanie sends them out, so I could talk your ear off about those.
And one thing I will add to that too, Rachel, we talked about this during our last leadership meeting, and that was when we're looking back at this program, things we could have done better. We talked about the marketing of the program. Quite honestly, this is probably one of the best kept secrets in Colerain Township. And I say that because when we first started this, we really didn't, again, no blueprint, right? And so no data from any other community to show what we were going to encounter. And we were a little concerned to market this. I say market, but to kind of throw this out to, like our social media outlets to say, hey, look at this great program. Do you have any needs? Reach out to us, right? So what we wanted to avoid is Rachel being a community health coordinator for 60,000 people. So we did a very soft launch in this, again, because we kind of classified this as a pilot project. So we did a soft launch and didn't really market it a whole lot. So when you ask that question about community response or feedback or pushback, that from those that are not engaged, did we get any information? We really didn't, because we didn't really throw it out there. The only people that really know about it are those that were benefits of the system, right?
Great, thank you. And then we have a few specific questions, Rachel, for you regarding your background. So do you have, I know you have your CDCA, but do you have any other trainings? You're not a peer yourself though, are you?
No, I'm not a certified peer. Yeah.
Okay. Just wanted to double check on that. And then as a county as a whole, I'm not sure who can answer this, but does your county have EPIC, the Engaging Patients and Care Coordinator, peer coaches, or do you have law enforcement, CIT, crisis intervention teams in your county?
Yeah, I'm not sure if I'm the right person to answer that. I have not heard of EPIC, if that's how it's pronounced, but the Engaging Patients and Care Coordinator coaches, I have not heard of that. I'm not sure if Hamilton County as a whole has that. It's not something I'm familiar with. Mm-hmm. And in regards to the crisis intervention teams with the law enforcement, I'm also not sure about that. I'm not sure if someone else on our team can, jump in and clarify on that, but I'm not familiar with either of those.
No, I don't think so. Not in the realm of what we're talking about here, from the CIS perspective.
Yeah, and like you mentioned earlier, Hamilton County as a whole has their own QRT, quick response team too, but so does Colerain Township individually. So in that vein.
Yeah.
And I kind of think we answered this, but has there been any pushback for people hesitating to even reach out to emergency services because they are aware of the program or afraid that their information is going to be put out there to the community or too personal?
I haven't encountered any kind of pushback in terms of that. If I do reach out to a referral and they don't want me, talking with them or asking what's going on, usually they'll just say I'm fine and we'll hang up, or I'll leave and I'll just close them out and say that they decline services. So there's no I definitely don't push any of the referrals to get services. It's all very optional. So as far as I know, we haven't had any pushback about members not wanting to call emergency services. Will, I don't know if you know of any.
No, I don't know, because a lot of individuals, I mean, like we did, like I mentioned before, we didn't really market this program, so people don't really know it exists. So they're not really concerned about that. I think though we can speak maybe a little bit to the addiction response, and maybe that there's a concern there that someone's not going to call for help in the incident that they're in the circumstances of an overdose, out of fear that, well, if I do this, then police and fire are going to respond. They're kind of going to come to my house. That might be the case. That's really kind of hard to measure. I think early on, the quick response team, we were called the Jehovah's Witnesses. The people were saying, "Oh, you don't call for an overdose because you're gonna get these people who are gonna come knocking at your door," and making those types of comments, those ridiculous comments. But again, cultural change has to occur everywhere. It has to occur within the agencies providing the service, but also has to occur outside in the realm of our community, because people are not used to that type of response from fire and EMS, and they're not really willing to accept it. But over the course of time, it becomes commonplace. Hey, chances are fire and EMS, they're going to follow up with you if there's additional needs.
Mm-hmm. And is in the position, is it 24/7?
No, I work 5 days a week, Monday through Friday, and normal business hours 8:30 to 5. Yeah.
And kind of leading into that, I just want to highlight the success one more time of just the program in general, along with QRT, just the great outreach that you all have done throughout the year in 2021, as well as 2022. And Will, you mentioned decreasing overdose calls and fatalities within Colerain Township is an all-time high in the past 10 years. So I think that's just a testament to the great work you all have been doing and the connections you've made between the health department and Colerain Township as a whole. So I just wanted to highlight successes one more time and applaud you all.
Thank you.
So yeah, so with that, I don't believe we have any more questions, but we will send out the recording along with the slides and the contact information. If you need to reach out to Will, myself, or Rachel, feel free. So thank you so much again. Thank you to our presenters, and we look forward to seeing you next time. Thanks so much. Have a good one.
Thanks, everyone.
Thank you.
Thank you.